Ventilation, airway, respiration, and ventilation. Adequate breathing must have an adequate minute ventilation, which is an adequate rate and adequate tidal volume. Inadequate breathing requires immediate management with positive pressure ventilation. Inadequate breathing is caused by an inadequate tidal volume, an inadequate rate, and a combination of both. Adequate breathing does not require positive pressure ventilation. Respiratory distress. Respiratory conditions are dynamic. They range from minor respiratory distress to respiratory arrest. It can be acute, chronic, or chronic with acute exacerbation. Signs and symptoms are dynamic and may change over time depending on the state of the patient's disease process. Many patients with respiratory diseases need only comfort care. It is important to know when exactly to provide an intervention, such as artificial ventilation, in order to increase the likelihood of patient improvement. In respiratory failure, inadequate alveolar ventilation is exhibited by a decrease in or excessively high respiratory rate, reduced tidal volume and the amount of air available for alveolar gas exchange, a decrease in tidal volume or both, and patients in respiratory failure are severely ill. The EMT must recognize the transition of a respiratory disease from distress to failure. 1. Deterioration in mental status, confusion, and loss of gag reflex. 2. Accessory muscle use, head bobbing, grunting, and nasal flaring. And 3. A decrease in SpO2. Airway adjuncts. Oropharyngeal or OPA indications. 1 is respiratory distress and/or failure, and 2 is unconsciousness in an unresponsive patient. OPA contradictions are gag reflex and presence of oral trauma, as in broken teeth or recent oral surgery. An indication for using an NPA or a nasopharyngeal adjunct would be respiratory distress and/or failure. A couple contradictions may be a presence of head or facial trauma and a presence of a skull fracture. When positioning a pediatric patient for artificial ventilation, the EMT must A. Place the patient in the sniffing position, and B. Place pads behind the shoulders. Newborn care. Suctioning the airway in the newborn may cause bradycardia. Suctioning immediately following birth, including the use of a bulb syringe, should only be done in newborns who have an obvious obstruction to spontaneous breathing or who require positive pressure ventilation. Presence of meconium does not necessarily require suctioning. Review AHA guidelines. Do not suction if newborn exhibits vigorous crying and/or respirations. Suction if newborn exhibits respiratory compromise and/or distress.